Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 239 of the Ask Dr. Angela podcast. Hopefully everyone had a great weekend. My weekend was fantastic. Even though I'm on call this weekend, I did manage to squeeze in the My Little Pony friendship movie with my wife, our mini-me, and some friends from Francesca's school, one of her classmates and her classmates' parents, whom we're good friends with. A good time was had by all. Hate to admit this, but I actually enjoyed the movie. It's a good message. And the soundtrack was actually pretty darn good. Amazing. Anyway, let's jump right into today's question. And these questions, folks, are coming from all over the world. This one is coming to us from Botswana. Botswana. I just like saying that. Anyway, this is what I'm going to call you KK because I cannot even begin to pronounce your name. But this is what KK said to me. Dr. Angela, greetings to you from South Africa. How is a bad vagina smell treated? I have bad discharge, especially after intercourse. Please help. Well, KK, you're not the first person to ask me or see me about a foul-smelling vagina. How we treat it really is going to be dependent on what the cause is. I mean, does your vagina smell bad because you just haven't taken a bath or a shower? I mean, that's enough to put anybody's vagina over the edge with regards to odor. Did you leave a tampon in there? I do a lot of tampon retrievals, and those vaginas, again, do not smell good. Or do you have like some underlying infection, like bacterial vaginosis comes to mind? That's probably one of the most common infections that I see that is not an STI, but can be associated with bad vaginal odor, specifically that amine, fishy smell. If that's what you have, we can diagnose that in the office. We can diagnose that by something called a whiff test. And yes, it is what it sounds like. We take a culture of the discharge, put it on a slide, and put some potassium hydroxide on it, and it lets off an amine or a fishy odor. We can look at it under a microscope and see something called clue cells, or we can actually send it to the lab for culture. If it does come back bacterial vaginosis, all that means is that there's been a shift in your normal vaginal pH from its normal acidic state to being too basic. And we just give you like a course of Clendes, Flagyl, Metrogel, whatever, your doctor prefers to prescribe, and that usually knocks that right out. One of the other things that I often will tell folks to do is just, if you're not too squeamish, go commando. Don't wear any panties when you're out. Let your girlfriend breathe. Fresh air does anybody good. So if you've got like a bad vaginal odor, I would get it checked out. Make sure that you're practicing good hygiene. If that's not the case, go to your doctor and make sure that you don't have any underlying infection. That can be ascertained by doing cultures. Other things like STIs could also, if left untreated, cause bad vaginal smell or odor. So KK, thank you so much for submitting that question. I'm so happy that you ladies in Botswana are checking out the podcast and following along. All the love and support is appreciated beyond the script. So if any of you happen to have a question or a concern that you want addressed on my podcast, you know what to do. www.askdrangela.com. That's AskDrangela.com. Click on the question and submit your question via email, or you can direct message me on Twitter, Facebook, or Instagram. I'm everywhere. In closing, I would like to leave you with this. Life's little instruction book tells us, Remember that winners do what losers don't want to do. That's point number 326. Thank you so much for tuning in. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 240 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.